Hi, I'm Dr. Lanika Buchanan, naturopathic doctor, licensed acupuncturist. Let's talk real quick about thyroid. So when you get your thyroid tested, thyroid is looking at your metabolism, not just weight, but looking at work in the body. How efficient is your body at doing the work that it needs to do to take food and make energy from it, right? So we do some blood tests, and the main one is called TSH, thyroid stimulating hormone. And that hormone comes from your pituitary and stimulates your thyroid and tells it what to do. So basically it's measuring the thyroid hormone that's floating around the bloodstream, T4 and T3. So it looks at T4 and T3 and says, all right, do I need to put on the gas, right? Is there not enough and I need to put on the gas and make you go faster? Or is there too much and I need to pull off the gas, right? So thyroid stimulating hormone is optimally really should be under 0.3 to 2.5 or even 0.3 to 2 is optimal range, okay? Reference ranges can be a lot higher, and that's not necessarily where people feel the best, okay? So the optimal ranges are a way of assessing your thyroid, so you really are looking at how it's functioning optimally. And so if that TSH is high, it means your thyroid's low, right? Because it's measuring what's happening and putting on the gas, increasing that number. So when that number's high, it means your thyroid's low. It's opposite, okay? So when that number's low, it means your thyroid's kind of hyper. It's hyperactive, going too much, okay? So definitely want TSH, free T3, free T4 are good values also. Looking at reverse T3 can give you a sense of what's happening with your adrenal glands as well. Stress glands, the adrenal glands, can affect the thyroid as well. So if you're under stress, sometimes your reverse T3 will go a little bit higher, which is kind of like putting on the brakes again to the metabolism. The other thing we can do is test your basal body temperatures. Temperature first thing in the morning, at least 97.4. Make sure that you actually are getting your value up there. Sometimes, the pituitary and the thyroid are fine, but maybe your T4, which is the carrier protein for thyroid, isn't transforming into T3, which is your active form. And that's the one that gets inside the cell and does the work, but it's also the one that maintains your temperature. So if you're someone who runs a low basal temperature, then even if your blood work's normal, then really we need to look at how do we support that thyroid function at the cellular level. And we can do that with natural medicine. So we can do that with vitamins, herbs, nutrients, all kinds of options. All right, thanks a lot. Talk to you soon.